high-end assisted living does not have to involve life with 100 more people. That is one of the myths that comes up when we discuss assisted living. There are programs that are much smaller, that are more than prepared to meet the needs of different populations, but at the same time are less overwhelming than if a person were asked to live in a more institutional type setting, regardless of the luxury that that physical structure might involve. It doesn't always match the psyche or the present mental development of the individual who's being placed there for care. A clinically competent program could be small. Now, it does mean that the program is competent, that staff have been trained in oxygen administration, they've been trained in how to minimize pressure so as to avoid the development of wounds. Staff has been trained in how to manage PEG tubes or how to assist in feeding someone who cannot do it for themselves. And yet that person's skill need may not rise to the level of having to be in a skilled nursing facility, and they can be served in the community. It might be a 6-bed program, an 8-bed program, a 12-bed program, a 20, but in any event, it is less overwhelming than most of the large programs. It's just a myth to believe that we have to be in those large, luxurious-looking programs because they appeal to the eye, but may not be necessary or may not even be the right program, depending upon what the person's needs are. And another mistake that gets made is the thought process that the longer an assisted living program has operated, that the more prepared that program may be to render the needed care. And that's a misnomer too, and here's why. A significant number of programs have existed for decades, and they serve the physically high-functioning, mentally ill, or those with developmental delays, but yet they are not trained to address the needs of a medically fragile population or a population of people who have been injured in catastrophic auto collisions, for example. And because they have become so accustomed to serving people who do 99% of what's needed daily for themselves, they find the transition to serving a population with a higher need level to be a real challenge. So the consumer who is shopping for residential care services needs to be concerned about that. If you were to take a minute and look at, say, Devoted Care in Shelby Township, Michigan, Presidential Caregivers in Ypsilanti, Michigan, Genesis Senior Care in Troy, Michigan, Wayne County Fragile Care in the Inkster, Dearborn Heights area, you'll find programs that were specifically designed to cater to the needs of a person who has serious physical limitations due to illness or injury, or persons with a degree of medical fragility, yet without a high skill need. And as a result of that, those programs can render the kind of competent, reliable care that a person needs who can no longer maintain life independently. So families, case managers, and others need to be aware of what the market has to offer before we insist a person be enrolled in these much larger programs that may have better looking wallpaper, but may not bring the clinical competence or even the person-centeredness that's needed to make the care delivery environment a success. And families need to understand what options are there. Families are often the ones making these rather troubling decisions. A lot of emotion gets involved. Very often siblings are at odds. Study what's available and then sit down and make a chart of what your parent or grandparents' needs are. And then as you shop, you check down that list to what extent a program you encounter can actually rise to the level of meeting those needs. Case management is a wonderful thing. It has its stressful moments, but it complements the work of nursing homes because the legs of Michigan Community Living and Provider Services are deeper into the community than what a nursing home social worker's legs might be. And so we are aware of more resources. There are tons of them in the community. We know where they are and how to make use of them, which gives us a special edge in assisting others. It's about understanding what's there and then making a decision with regard to how to go about using it.